I want to give some background facts and information from our end so that all of you are aware of what happened locally. As we went into inclement weather, it was clear to me that we likely had doses that were prepared or getting prepared for pods that could occur or were scheduled to occur during the week of inclement weather. So at that time, I began to ask very diligently, how much vaccine did we have? What was potentially out that could expire? And what were our backup plans to be able to administer that vaccine without any waste or loss of vaccine? Through that process, it was brought to my attention that there were some doses that had been wasted that were in the pharmacy. As a result of that, we did several things. One, and I'll come back to reporting to the state, but our initial focus was on how do we look at all of these expiration dates and get as much vaccine as we can out to the public, even though we were going to have inclement weather. As of today, we have been closed a total of 10 days. 2 days on the 11th and the 12th for ice, the remainder of the next week for snow and ice, and then obviously the water pressure issues. So we had an exceptionally long period of inclement weather that not only was going to impact expiration dates, but also greatly impacted our inventory. We continue to receive vaccine even during the snowstorm. Those deliveries were en route and were added to our inventory. So our first focus was try to get all the expired doses out to the public, or expiring doses out to the public before there's any waste. Secondly, to develop a distribution plan for the existing vaccine that we had, and that plan also including asking the state to stop any shipments so that we could use the inventory that we had in hand that was continuing to grow because of inclement weather. The other and more important piece was reporting to the state that we actually had wasted doses within the health department. I initially called with Dr. Martin, Dr. Fiscus on Saturday, that was the 13th, to report that we had wasted doses. I made additional attempts throughout the week to reach Dr. Fiscus without a return call. Ultimately on Friday, the 19th, I called Dr. Tim Jones and made the verbal report to him that we had wasted doses. I knew at the time of reporting that when you report a large loss of doses, there is a process or a cascade of events that occurs. And that was one, we expected that the Tennessee Department of Health would visit us. They would work with us to identify all of the root causes that contributed to that loss, as well as provide any technical assistance, guidance, or education that's necessary to make sure that safeguards are put in place. We welcomed that team on the evening of the 19th. We continue to work with that team on the 20th, and then we have worked with that team throughout this week. And as we get towards the end of the week, what we will have in place is an agreed upon plan that allows us to work together to address any deficiencies that we had in processes internally so that we can receive vaccine in the future and distribute that in an effective manner to this community. And that's generally what will happen when an item is reported to the state. And again, we're working closely with the state on that process and have continued throughout that process to share with the state any challenges that we anticipated. And we've also made recommendations to the state. The other thing that I want to share is that on the evening of that Friday, the 19th, when the health department visited us, it was my request that we not receive any additional vaccine. I had previously made a request that we needed to not have vaccine because we had too much inventory. We knew on the 8th that we had significant inventory. In part, we knew that we were going to be vaccinating teachers soon. So we wanted to have at least 10,000 doses for teachers. And then we had inclement weather hit. So on the 19th, I did request that no vaccine be sent to the health department until we could, one, reduce the inventory and then rectify any deficiencies that we may have had in place.